Hi, I'm Amy Graham, a speech-language pathologist in Colorado, and I specialize in speech sound disorders. What is a lateral lisp? A lateral lisp is where the airflow on sounds like S and Z and CH and SH are directed over the side of the tongue rather than down the center. So instead of S, it sounds like sh, and it sounds a little bit slushy in the cheeks. How do you correct a lateral lisp? Well, this is one of those errors that it does not occur in typical developing speech. So if you have a preschooler who has a lateral lisp that sounds like this, that likely will not correct on its own. But if you're an adult and you have a lateral lisp, it's never too late to correct. For example, my very first client was my sister. At the age of 21, I helped her correct her lateral lisp with the same strategies that I'm going to explain to you today. Before we do any intervention as a speech-language pathologist, we need to do our due diligence with our assessment just to look at that oral mechanism, look at the structures of the mouth, just to make sure that everything is within functional limits for speech. So if you're an SLP, make sure you're doing a really thorough assessment. But there's one way that we can tell if we can correct a lateral lisp with the strategies I'm going to explain to you today. And that is if a child is able to say other sounds that are similar in placement to the sound that you're trying to elicit. So let's talk for just a minute about what a lateral lisp looks like from the inside. What's happening is the blade of the tongue or the tip of the tongue is touching the palate up behind the top teeth so that the airflow is escaping over the side of the tongue. So that's why the S sounds like this, because the tongue is in the wrong spot. So what we're trying to teach is the tongue to do the opposite of what it's doing. And that is to elevate the sides of the tongue and anchor them up by the molars, by the gums, so that these parts of the tongue go up and the airflow is directed down towards the center. Now, if you're just using a traditional speech therapy approach, you're probably talking a lot about how let's move the sides of our tongue up and touch the molars while you say S. And you might notice that the clients, if you're an SLP, they struggle with that because we're fighting muscle memory. When their brain thinks about the S sound, their tongue goes back to what it's used to doing. So my favorite strategies for remediating any type of a lateral error are phonetic shaping, which we'll talk about in just a minute, and cognitive reframing. So let's talk about phonetic shaping. If you have a child, or if you are lateral lisping and you can produce the T sound correctly, what do I mean by correctly? Are you using the sides of your tongue? Do you feel the sides of your tongue up against the molars, up against the gums? And do you feel the tongue tip behind your top teeth, at that little bone behind your top teeth? If you can produce a T sound crisply and accurately with correct placement, then we can use phonetic shaping to shape that T sound into the sound that we're trying to teach. So let's, for example, take the S sound. If you can say T and you can keep your tongue in that position and hold it out T, and make a longer T, stretch it out, that is S. Your tongue is in the right position for the S sound. So that is where I tend to start if I have somebody who's lateralizing the S sound and I want to use T to phonetically shape it. However, if you work with kids, you might notice, you might try this strategy and it might sound like t, t, t. They go right back into lateralizing. If that's what they're struggling with, that is where my resource, the lateral and frontal lisp cues deck from Bjorn's speech comes in, because I authored this deck to help those kids reframe it, help them understand it like it's not your S that we're trying to fix. You know exactly how to say your S sound. I'm not gonna fix your snake sound. You know how to do that. I'm not gonna fight muscle memory. I'm gonna teach you how to say a brand new sound, and our brand new sound that we're shaping from T is called the flat tire sound. All right, are you ready? All right, I want your eyes up here. So what animal is that?
A snake.
Do you know what sound a snake says? Yeah, that's that S sound, right? Yeah. That's our S sound. I have a new sound I want to teach you though.
A S?
No, it's not an S sound. It's a brand new sound. I have actually two brand new sounds. I have a TikTok sound.
Wait, I like TikTok.
What does TikTok say?
TikTok.
It does. It can say that, but my TikTok says this. Watch me. It's only my tongue that's moving.
T.
That's exactly what my TikTok says. So when I have this, we're going to say, no, my tongue doesn't move. Stay super still. That's it. You got it. And if I hold my TikTok sound out, watch this. Hold out that TikTok. Do it again. Oh, your tongue moved a little bit. We have to keep it in that TikTok spot. That was it. That's my flat tire sound. It sounds like somebody poked a hole and the air's coming out. When I go like this, listen to this. Watch my mouth. No, don't do it. Just watch. I'm using my tongue. Do it again. That's it. Do it again. Yeah, that was really good. Sounds like a little hole got poked through that tire and the air is escaping. That's what we're going for. So that's the idea of cognitive reframing. Help somebody think about it from a different angle, because if they are struggling with that aspect of they just can't shape it from the T sound, it's an issue up here, it's not an issue down here. You can use phonetic shaping for other sounds that a person might have in error, maybe the CH sound. If somebody is struggling with the CH sound, it might sound like, I like to eat cheddar cheese. It might sound like that. If they can do, again, the T sound, and the sides of the tongue are anchored up against the molars, and the T sound is produced, that sound is right at that spot behind the back teeth, then you can use that T sound and just direct the person, the child, the adult, whoever it is, to just round your lips, push your lips out while you say T. So it sounds like this. And we're gonna say our clock sound. And with our lips out. There's a B. Put a B in. Say the clock sound with our lips out. Good job. There's a B. Now let's say that same thing. That's our spray bottle. There you go. Another one. Spray bottle. Good job. All right, let's put our lips out and say the clock sound. Good job. Keep going.
And then 2 more reps.
All right, there you go. 2 more B's. Let's say it 2 more times. Good job. Put them in. Let's say it 3 more times. Wait, let's say it with our really good lips and our clock sound. And progressively, as you work on that and teach that and shape that, you might even have to say things like push more air as you say that T sound. What happens is you're trying not to correct that person's or that child's trained sound, that lateral CH. You're actually teaching them the new spray bottle sound. But we're starting from a T, rounding our lips, and shaping it progressively through therapy. You can also use phonetic shaping for the SH sound. I've had some kids that struggle with SH like sugar, and it's that lateral airflow that's escaping over the sides of their tongue just for the SH sound, but some kids have a great S sound. So I'm gonna have you say these words right here. Do you remember what they are?
Shock.
Yeah.
Shade. Shack. Shy.
Yes, you're right. Now that's your old SH sound. So the way we talked about it before, you could say a beautiful S sound, right?
Yeah.
Let me hear your S. Okay, now what I told you before, because we got a really nice windy sound, when I said we're just going to make your S sound, because where are the sides of your tongue? They're touching
They're
what?
touching the inside of my teeth.
When you're saying S, right?
Yeah.
Love that. Okay, so all you're going to do is we're going to say that S sound, but then you're going to round your lips while you're doing it. Do it again. And that turns into what?
The windy sound.
Okay, so let's hear the windy sound all by itself. I love that. Now, I want you to take your tongue tip just a teensy bit and curl it while you do that. Can you do that?
Yeah.
Okay, go for it. Now, can you use that new windy sound for that word right there?
Shock.
Nice. What's that one?
Shade.
Shade. Good one. What's that? Yep. And how does she feel?
Shy.
Nice. Is that getting easier?
Yeah.
So you can use the S and shape that into an SH. Do it yourself. As you're sitting there, if you can produce both sounds correctly, S, sh. There's two different points of articulation that change from S to SH. And that is the lip shape and the tongue placement. So when an S, we produce an S sound, lips tend to be more retracted, more smiley. S. When we say an SH, sh, lips come forward, more rounded. Sh. The other thing that's happening is S, s, tongue is a little more forward. For SH, we curl it just a little further backward. S. So if you have a child and they have a great S sound, you can start from S and just cue them to round their lips. Don't worry about tongue placement yet. We want them to think about this like an S sound with your lips out. So when they go from S, that might be what it sounds like. That is okay. If it sounds a little bit like an S, we're good with that. What we're going for is elimination of the lateral airflow. And so even if it sounds a little bit like an S, we're good with that. So if that lateral lisp airflow, that lateralized airflow is gone, what we're teaching them is the new windy sound. So we're not trying to fix their old lateralized SH. We're trying to teach them this new windy sound. And this cognitive reframing is what is behind this particular resource from Bjorn's speech, the Lateral Frontal Lisp Cues deck. And this can be really helpful with your elementary aged, your preschool aged kids. And yes, you can do this with preschool aged children. I've had success with 3-year-olds. I've had success with 4-year-olds. In fact, my preference is, since this is not a developmental type of error, we don't expect kids to grow out of it, the earlier the better. I love starting with around 4-year-olds. Around that age, I find I make the quickest progress because, for one, they're old enough to understand what we're talking about, to pay attention to those cues, but they're also young enough to where they have not habituated this incorrect production for as long as, say, a 10-year-old or a 15-year-old or even an adult. But if you are an adult and you struggle with a lateral lisp, it is not too late. My sister, like I said before, she was 21, and when she struggled and she finally decided that she wanted to correct her lateral lisp, she had been in therapy for years and struggled with it. Her speech therapist didn't understand how to help her correct it. So using these specific strategies, using phonetic shaping, starting from a sound that she was able to produce correctly, and shaping that into this new sound, she was able to remediate that. And I'll let her tell you the story behind that, but she remediated that within about 10 minutes. I never heard her lateralize again. So it can be done, but it takes lots and lots of practice. And what do I mean by practice? So if you can elicit a sound in a particular context, let's go back to the S sound, and you can elicit the S from the T. Tss. Now what do we do? Well, now we're going to go into the next most phonetically facilitative context, meaning what's the next easiest thing to say? And that would be final TS words. So I would grab words like hat, tss, bat, tss, cat, tss. And instead of using your S sound there, we're not going to use our S. We are going to use the flat tire sound instead of that snake. And this might be where kids get hung up. I'll have my kids, they can do a great T sound and holding it out, but the minute I go to a word like hats, it goes hat. That's okay. I'm going to back up a step and remind them we're not trying to correct your S. I'm teaching you this new sound. Remember, all you have to do is hold out that T sound, hat, tss, and use these visual cues if they're helpful. Now, this is a tricky sound to remediate, so if you are still struggling, take my 2-hour course, Lateral Lisp Remediation from Elicitation to Generalization. It has many more strategies for places you might get stuck in therapy. It'll teach you how to promote generalization with your kids that you're treating who have lateral lisps. All of my resources are linked down below. And if you're still struggling in therapy, maybe you're an adult or you're a parent. If you are still struggling with your lateral lisp, or you're an SLP who's struggling treating lateral lisps, I have so many more videos, real world videos where you can see these errors being remediated in real time, or strategies where you might be stuck that can help you get out of that. They're all included in my 2-hour virtual course that you can take at your leisure, 2 professional development hours. It's linked down below. Parents, this can be for you too. Now, this course is directed towards speech language pathologists, but I get weekly messages from parents who've taken my course and actually helped their own children correct their lateral lisps. Again, I'm Amy Graham, speech language pathologist in Colorado. I specialize in speech sound disorders, and I will be posting tips every Sunday, so follow along.